products in the hands of somebody that knows what to do with them. And this is the practice to come to. This is one of the premier practices for the East Coast, in the country, as a matter of fact. From a training standpoint, an education standpoint, just from being on the cutting edge of everything that's out there in aesthetic medicine, this is the practice to be at. And there's a lot of practices that do things well, but I think what really sets this practice apart is the people here. We have a bunch of wonderful people that work here. They've been here for a long time. The physicians are wonderful. They hire great people. And the physicians they bring on, some of the newer physicians they bring on, not only do they train them right from a medical standpoint, but they just hire good people. And that's really, really important. And I think that is the products are obviously great and necessary, but that's secondary to the care and attention that you receive when you come to this practice. And I believe that from the heart, because I've been working in this practice for a long time. And everybody from the second you walk in to the second you walk out, they're top practitioners. So, anyway, now I've got that, I just want to kind of go through and talk a little about what to expect with Botox Cosmetic. There's basically 6 questions that people ask when they do this. What can I expect after I get? So some patients say they feel like they're children. Anybody that's had it before, I'm scared of death of needles. I don't like needles at all. Most guys are kind of wimps when it comes to needles anyway, and I'm no exception to the rule on that one. But it's really just a tiny pinch. It's a very small needle that's used. That's why they call it kind of a lunchtime procedure. You'll see very little downtime. There won't be really any bumps or lumps or anything like that, or bruising. It's just a very simple procedure. Some people use numbing cream, but it really does not hurt at all. Very short process. Now, if you're new to the practice, if you haven't had Botox before, there'll be a little bit of consultation period just to kind of find out. And there's going to be some things that they do to like tweak your treatment as you start coming back more and more. But essentially, the entire procedure only takes a few minutes to actually have it done. So it's very convenient from that standpoint. And I will just add that since we filed Botox Cosmetic approval in 2002 in the United States for cosmetic use, there's been over 13 million injections. Has excellent safety profile as well. So this is the thing a lot of people worry about, is I don't want to look overdone or look like I have frozen face. And that's where, again, we talked about before, having a product and having a product in the hands of the right injector for that too. And that's where you really develop that relationship and really get to know the physicians and the injectors so that they give you what you want. Not too much, not too little, just what you need. And I think that's really important to have that kind of relationship and the consistency and keep coming back to the same place so that you're not, jumping all around just to go for the next best deal. That's certainly, we're not shopping for a dishwasher here. We're taking care of our face and taking care of something that's very important that we have to live with and see, obviously, every day. Minimal downtime, we talked about this. I don't know. Anybody have any issues, any headaches or anything after their injections? Has that ever happened with anyone? First time I had it done, I was out in training when I got hired with the company, and I had a headache the next day or two, but since then it hasn't been an issue. But everybody reacts differently, so it's, again, very minimal. So cost considerations, I touched on this just a little while ago too. So we're not talking about when we do a technique, it's including the cost of the actual product as well as what the injector is putting in. And that is not just a simple procedure. We're talking about the skill and training that's been involved, the patient attentiveness to each patient, each particular person that comes in here. One thing it says here is be wary of discount products or cheap Botox. If it sounds too good to be true, it probably is. And that's the case. You can find products cheap, Botox cheap somewhere. But if you're going somewhere because of the price, and if it sounds too good to be true, it's probably either an account that is very inexperienced using the product, which you certainly don't want. There is, believe it or not, still a lot of counterfeit Botox out there. It's not purchased through Allergan. You can't guarantee that it's actually the proper product. So there's a lot of discounting that's going on, a lot of things that is allowed more people to really try the product because of the price point it is. But overall, when you're looking at it, look at it more of the value and the peace of mind that you're coming to a practice that knows what they're doing, they've been doing it for a very, very long time, and you're going to get quality results from it. Anybody with questions with regards to Botox, what you expect? Okay, great. I'm going to move on to the collection of fillers that we have, and you can see these Jupiter boxes up here. The boxes actually look like when they purchase them and they come in vials, or actually syringes. But our tagline for the Juvederm family of products is everyone knows, but no one will know. Filler patients, any filler patients here? Good? Okay, good outcomes, good results, happy with it? Fillers are actually the fastest growing segment in the aesthetic medicine part community right now. It is something that when I started just about 5 years ago, it was really starting to build and build, and I think we've gotten some really great products now with Juvederm and especially Voluma that allow the injectors to really do a lot of different things, do it much better than they were able to do because they have such a real dependable product with a quality and a history as well as doing, doing some really good things for patients. And again, it's that subtle look we want to go for. We don't want to look overdone. Anybody can get their lips blown up like that or their cheeks overfilled. But if you're coming again to a practice reputable like this and you develop that relationship with your injector, you're going to see the results that you want. And I really feel like that just in the past 3 or 4 years, I think we've really seen a really uptick with filler because people are doing it better and they're utilizing it more. And I think we even started targeting differently. I know that with Juvederm, with Ultra Plus, we used to kind of just go and try to fill in the lines. Parentheses was one of our marketing campaigns. So these parentheses have a place just on your face that we use for Juvederm. And I think even now with the development of Voluma, we're seeing more and more physicians look at the face differently and really starting that mid-face area and correcting there first, and then seeing once we get the mid-face, kind of that anchor, then to kind of go and see where we can go from there. And it really is, I think, and Dr. Halvorson will probably speak on this later, but it really has kind of redefined how we look at using facial fillers and how we define what we're doing as far as improving the look with facial fillers. And Voluma is probably kind of pioneered on that. We have a new product that's been approved that's similar to Voluma, but used in a different area. Matter of fact, this practice was the first practice in the state of Maryland to use Voluma. They had their hands on it first. They will also be the first practice to have their hands on Voluma, which is our newest filler, and that'll probably be sometime around October. So again, it goes back to really coming to a place that is on the cutting edge and just really has a great understanding of what these products can do and maybe utilize them the best way effectively for them. Any specific questions on the fillers? Yes?
I just wondered about the new product. You said used differently in different areas.
The new filler products coming out. So Voluma, which is it's based on the same technology as Voluma, is going to be used in the lip area. Marionette runs lines around there as well too. We have Juvederm that does that now too. But it's a little bit different technology, and there's going to be a different way that I think the doctors are going to use it as far as specific patients, what you're looking for. Again, customizing or tailoring your specific appearance and what you want to have. We'll have more information about that as the product comes out and as we get it out to them. We're just waiting to have the approval from the FDA, but we're actually trying to get a different syringe size because it's already been approved around the world for several years in a lot of different countries, 70 different countries. We found that there's a specific syringe size that's really the optimal size. So once we get that approved, we'll have that launched in the fall. Good question as well?
That was the same. I had the same
Oh,
question.
sure. Yeah, I like it. Everybody's asking about the new product. We don't even have it yet. I'm always asking about new stuff too. Being the representative for the company, I'm usually the last one. They only want us to talk about what we have already. So, but it is approved, so I can talk about it. I can tell you it's going to be. I really think it's going to be a product that is going to the way that Voluma revolutionized the way that we look at face and then face. I think that they're going to be able to do a lot of things with Voluma. And again, you're going to want to come here to have it done because you're going to be the first ones with it. Any other questions on filler?
Yeah, I think it was a jump.
No one? Try to get up here. So our newest product, besides the filler we just discussed, is Kybella. Anybody heard of Kybella? Familiar with Kybella? Understand what it does? Like that. So we'll spend a little bit more time on this. So essentially, Kybella is the first and only medicine approved to correct moderate to severe fat below the chin. So it's essentially a double chin destroyer, which is outside of Kybella. The only other options that you have now, up until Kybella was approved, was surgery. There's also some machines that do it as well. But the great thing about Kybella is it's very customizable. You can use, you can use it in different dilution types. You can use it, Each patient's going to need a little bit different depending on the severity of the submental fat in there. It's going to use more or less depending on it. I used a bit. I was one of the first patients treated again. They had the Kybella the first and the standing rail and used Kybella, and I had some excellent results with it too. And it's a really great product because it allows people that didn't first of all know that you could even treat this before without surgery. It gives you an option to start thinking about if that's something that really bothers you. But you have an option now to treat it without having to worry about surgery. And that's a huge thing. We did our surveys for this. It fell second. 67% of the consumers we interviewed said that they were bothered by the double chin, and that was just below the 71% that were bothered by the wrinkles. So it's a product that, while relatively new, has been getting a lot of traction, and I know the doctors here are using a lot more. And I think where we need to come in as a company is we're going to start a direct consumer campaign in a couple months, where we're going to start seeing television commercials and educational slides and things like that on the internet, as far as print ads and things like that too. So it's definitely a really cool product. It is the first thing of its kind, and once you have it treated and you have that submental fat treated, most likely you won't need a retreatment of it. So it's, can't really call it permanent, but it's about as close to permanent as you can get. Question?
Yeah, how is it used and how does it work?
Sure. Do you want me to take this, or do you want to talk about that?
If you could take it, that'd be great.
Sure. So essentially, it is injected. What we actually do, we will, the physician will do a consultation and talk about what you want to have done, and just kind of explain to you, okay, we actually have these little marking grids that we actually put on your chin area, and there's dots on each of the marking grids. So depending on the number of dots in the treatment area is how many injections you get. You get a very small Botox needle, but very much. And essentially, when this oxalic acid is injected, it destroys the fat cells. It really explodes the fat cells. Okay? So because of that.
I can use that all over my body.
Yeah, well, that's coming down the road. One approval at a time.
Thank you.
It essentially
Thank you for
explodes.
giving me hope.
It destroys. We're excited about it too. Because it's just approved for some metal fat, that's all that we can really discuss about. At least I can really discuss about it. But I've heard that from other people as well too. They're kind of excited about that. So what it does, it essentially destroys the fat cells on contact. You will see some swelling because of that, which lasts for a few days. And then the fat is eventually extricated from your body and it never comes back again. Once the fat cells are destroyed, they don't reproduce. Some fat cells can get bigger or smaller, but once they're gone, they're gone. So it's a really, it's a great product. It was exciting to talk about, to get some really good questions like that from people, because it is new. It's it's Botox and fillers we've been talking about for years. It's something to, yes.
Once the fat cells are dissolved, how is the condition of the skin?
Sure. I'll let you talk about that a little bit.
Sure. Yeah, I think the skin, it probably tightens a little bit. Of course, the way it works mostly is dissolving the fat, but we don't find that people are suddenly left with these horribly loose necks. There's probably a slight amount of tightening that also occurs. If people feel like they are left with a lot of extra loose skin, there's other procedures that can be done to address that, but I think we find mostly that the fat dissolves and there's a much better contour to the area without any major issues with just loose skin left behind.
Any difference between men and women and how they respond?
I don't think so, nothing that I've noticed.
It's interesting from a male and female standpoint. There's obviously a lot of patients that come in, or female patients get Botox and didn't know if there was an alternative, wasn't an alternative before, they're really getting it. But there's also a lot of men. It's one thing that always bothered me. This isn't something that losing weight ever helped me with. If I lost weight, I would still have my double chin. I could look at my college pictures, still have the silver on that. It's just hereditary. I blame my parents and my grandparents. So we're trying to stop that cycle right now, and now we actually have something to do that. But it's an exciting product. It is something that you might need, depending on you're going to need at least one treatment, possibly two, and maybe even more depending on severity. That's something once you go into the consultation, we discuss with you when you inject the physician. So it's really cool. It's a fun product. And I encourage you all, if it's something that has bothered you before, to really have a conversation about it, because I think it's something that you can take care of. And really make you happy. Any other questions about it? Okay, well, great. Thanks. for your time. I appreciate you listening about the products, but again, I really want to emphasize that the products are the products. It really is the people that are doing the injecting, and you can't come. There's not a better place you can come to, and I sincerely mean that. To really get a quality of service and really fantastic staff that are friendly, knowledgeable, and just do a fantastic job.
You're here.
All right, I'll turn it over to Dr. Halvorson.
Very much. And I'll be talking a little bit more about fillers and Botox, some of the products that we use, where we use them, why we use them there, and how we select a certain product for a certain person. First, thanks for coming. I really appreciate you coming here. This is a fun topic for me to talk about. We do fillers and Botox all day, every day. It's something we're really passionate about, so it's I look forward to talking with you guys about it. Mike talked about this a little bit. Why are fillers and Botox so popular? Well, I think more and more people are realizing that it's a really cost-effective way to look more youthful without surgery. These days, people tend to be so busy with their social lives, their work lives, they don't have time for a major operation like a facelift where they would be out of commission for a few weeks. So a lot of people seek these really minimal to no downtime procedures to look better, and the products are getting better and better, they're working great, and so as a result, more and more people are seeking these treatments. I think a lot of people have a very good idea of what Botox is. I think people who haven't had fillers before, they tend to be not quite so sure. So I thought I would start by talking about fillers. What are fillers? Most fillers are these gel-like substances that are injected with a needle under the skin, and they're used mostly to help to restore volume to the face and the lips, and to smooth fine lines and deep creases and just improve overall facial contour. So it's like a revolumizing type of treatment. There are many, many different fillers that are available. There's more coming to the market all the time. There are the Juvederm products that Mike talked about. There's Restylane, Radiesse, Belotero. There's a lot to choose from. It can be a bit overwhelming, but that's why we can help to try to direct you in one way or the other. I would say in our practice, the product we use the most is the Juvederm Voluma, but there are certainly situations where we would choose some of these other products as well. And then what are they made of? Different fillers are made of different materials. The products that we use mostly here are made of hyaluronic acid, or HAs. And we really like products that are composed of HA because it's a naturally occurring substance. It's something that's already in your body. It's in your joints, it's in your skin, and so it's exceptionally safe and well tolerated by people. Its normal job in the skin is to keep things plump and hydrated, and that's also how it works as a filler. It's temporary. It lasts, for most people, the fillers, anywhere from 6 to 12 months, although certain products, if you use enough of them, can last up to 2 years. And most of these HA fillers are combined with some lidocaine, so it's a very comfortable procedure, well tolerated. And these are some examples of the products down below. So Juvederm, Belotero, Restylane, they're all in this HA family. So now to the more fun stuff. How do we use these products? Again, the main way they're used is to revolumize the face. And Mike touched on this. The trend in fillers has really changed over the last few years. It used to be that fillers were injected kind of directly where it seemed there was the problem. But now we know that you have to really address the underlying issue, which is kind of the sagging of the mid-face, in order to get the most improvement in the areas that maybe you notice more. So really revolumizing is the goal, and this helps to depict why volume is so important. So in a youthful face, we have these fatty pads that are on the cheek area that give high cheekbones and a very youthful appearance. And then as we age, these fatty pockets start to deflate and they start to descend. And as a result, we get this hollow appearance under the eyes. We get the formation of these nasolabial folds. We get these marionette lines and the formation of a jowl. And so that's what really helps to contribute to aging. And so if you can address this sagging and this deflation of fat pads, you can get a really nice improvement. And this is looking at the same problem from a different angle. So the youthful cheek has this nice curve here, And then as we age, those fatty pockets, again, they deflate and they descend, and it becomes a flat, sunken area. So these days, again, the trend is to use products such as Juvederm Voluma or Restylane Lift to reinflate these areas. And our typical injections are in a pattern such as this. So this is the area we need to reinflate, and so by just a few needle punctures in this area, we can inject filler and really restore a youthful appearance to the cheek. And these are some of the better results that you can get with products like Voluma. You can see with aging, really a sunken lower eyelid area, formation of these nasolabial folds, gel, and then if you use enough product, you can truly achieve like a liquid facelift, essentially. You know, this is someone admittedly who have many syringes of treatment spaced over time, but you know, these are the types of results you can get if you are consistent with your treatments, you have enough product that's used. And just looking head on, same thing, there's improvement in her nasolabial folds, her marionette lines, and under her eyes. She looks so much more youthful, all without surgery. And then similar things in this younger patient before, very prominent nasolabial folds, her cheeks have lost some volume, and then with some filler like Voluma, you can see she looks much more youthful on that other side. So again, these are patients who have a lot of product spaced over time. I think in kind of a more real-world setting where you're not using a lot of product at once, this might be a more kind of typical result you get in a patient. So here, you can see the cheek volume is really deflated, the skin looks loose, it's sagging, and with a syringe or two of Voluma, you can get a nice lift to the area over here, and just looking at it, she looks so much more youthful in that area, and that's a nice result. Other areas, of course, people tend to notice are the nasolabial folds. So as things sag, a shadow is created, and that can give an aged appearance. So if you inject some filler, into this area as well as into the cheeks to get a lift, you can really get a very nice improvement. And this is another example of the same thing. So some filler into this area as well as into the cheeks. And then of course the marionette lines here. Again, the best way to treat this, injections directly into the area as well as in the cheeks to restore that underlying problem. Another area where we do a lot of filler injections around the mouth. This is a very annoying problem for many people. These lines, these vertical lip lines or barcode lines, they can be very hard to treat, but with a combination of filler and Botox, they can really be softened and make a nice improvement in the appearance. For this area, you want a thinner type of product, such as just Juvederm Ultra or the new product that's coming out, Restylane Silk, Bellatero, so they can certainly be softened and much improved. And then this is a patient I treated a couple weeks ago. This is the before and the after. Of course, the lines are still there, but they're really softened and they look much better. That was a combination of filler and small doses of filler. Of course, another area where filler can be used is in the lips. In this practice, like Mike alluded to, we try to do things very naturally. We don't try to overinflate the lips. We want them to look natural so that people think you look great without thinking you've had something done. And you can see it's a subtle improvement on that side over there, but it's real. Those lips look much more plump. They look a lot nicer than the original very thin lips. That was like a Juvederm piece here. And then this is someone who I think had Restylane Silk. This is from the company, but you can see before and after. The lips now, they're subtly more plump. They appear less kind of crinkly and they're stretched out a bit. And the product was also used for some of those lines around the mouth. So a softening, a very natural enhancement without anyone being able to tell something was done. Another area where we're using more and more filler is under the eyes. This is one of my favorite areas to treat. Again, as those fatty pockets descend, you can get this hollowing under the eyes. It makes you look tired. People ask you, are you tired? And if you fill that up with some filler, you can get a very nice improvement, like you can see over here. This is Linda who works here, but I think you can see the filler under the eyes really gives a nice improvement. No one would ever be able to tell you had something done. You just look more rested. And this isn't a patient treated here, but this is something men commonly see. This treatment of filler under the eyes. Again, he looks more youthful, more rested. You'd never know anything was done, and that's a very simple procedure to do. One of the newer types of fillers that has come out is called Bellafill. This is a semi-permanent type of filler used for acne scarring. And so this is a case where that was used, and you can see these very deep shadowed depressions are much improved, and these results will be maintained for a few years after the treatment. So that's a newer option for people with acne scars that if you can stretch them and make them kind of look less noticeable, those are the scars that respond best to this treatment. And then a kind of a brand new thing we're doing over the last year or so is a lot of filler into the hands. So we also lose fat in our hands. That makes the veins look more noticeable, the tendons look more noticeable, and so with a product like Radiesse, you can get very nice results, a more youthful appearing hand. And then I thought this was cool. This is filler into earlobe creases. So it's a subtle thing some women notice, and just a little bit of a product like Restylane can stretch out those creases. It looks really nice. So what do you expect during treatment if you've never had filler before? Basically the way it works is you come to the office, we take some photos, and then you sit with numbing cream for about 45 minutes to an hour. You're brought to a room, you have your procedure, and then you go home. Most people can go back to all their normal activities that same day, but some mild bruising and swelling is possible. So you certainly wouldn't want to schedule a filler like a day or two before an important event. You want to give yourself some time in case you do have some bruising or swelling, because that can take a few days or even up to a week to kind of fully resolve itself. And you usually see your results right away. It can take a couple weeks for fillers to kind of fully settle in, but there is typically a noticeable result right away. And then how long do the results last? Again, it could be 6 to 12 months or sometimes even up to 2 years with newer products like Voluma. But although it does vary patient to patient and the location where you treat. So typically the lips doesn't tend to last quite as long. So that's filler. Briefly, I'll talk about Botox. Botox is probably the product we use the most of, but there are other types of similar products also available here, like Dysport and Xeomin. They also work very well. They each have their own, I think, slight differences, so occasionally we'll choose one over the other. But Botox is probably the #1 product that we use. Again, these are some of the other products, Dysport and Xeomin. And they can be used in so many different places, more and more places all the time. The typical place for Botox is in these kind of glabellar lines here. I think people who are just starting with Botox, that tends to be the first place to start. And then oftentimes forehead creases around the eyes and other places on the lower face and the neck can also be introduced. Kind of the more treatments you do, the more comfortable you get with it. But this is the typical kind of scenario you would use Botox for. These creases here that when you frown, people form these 11 lines, and the more you do it, kind of the more permanent those lines seem to be. So when you treat that area, you end up getting like a much smoother contour, and you also get a lift to the brow. That's something that people love, is you can get a few millimeter lift to your eyebrows, and that just can give a much refreshed look. This is a patient I treated a couple months ago. She was concerned with some of these 11 lines here. And so this is 2 weeks after her treatment, they're much improved. And it's hard to see, but her eyebrows have actually lifted up a little bit as well. She has a nice arc to her eyebrow. It looks very nice. This is her as she's trying to frown, so she can no longer make this face here, which bothered her. So it looks much nicer now. And then as she tries to raise her eyebrows, it's very smooth, but at the same time, you'd never be able to know she had something done. She just looks more youthful and rested. This was another patient of mine recently who I loved her results. I think the thing to notice is how before her Botox, the eyebrows are very flat. She has these creases here. And then afterwards, she got this great elevation to her eyebrows. She now has a bit of an arch to her eyebrows. Her eyelids weren't so heavy. So this was with 30 units of Botox, and that was about 2 to 4 weeks after her treatment. Just gives her such a nice, more youthful, refreshed look, and she's very happy with that. This is a patient of Dr. Beasley's. The same thing, she had Botox to try to lift her eyebrows, and you can see before they were very flat. Now they have an arch to them, very cosmetically appealing look. Men can get Botox as well, of course. So this is with, I think Dysport was the product used here, but injected both here and into the forehead can really improve the area. And then crow's feet, certainly a big area where we treat with Botox. As we age, and when we smile and squint, we end up getting these longer lines. And so if you treat that area with a product like Botox, when you then smile, you can see you don't quite get that same formation of the wrinkles. I thought I'd show a few other areas where you might not think to get Botox, but in the chin, this muscle is called the mentalis. As we get older, it kind of becomes stronger. It can lead to like an orange peel type contour to the chin. So if you just put a few units into that, it can really smooth out and look much nicer. This is a subtle thing, but there's a muscle here called the depressor anguli oris that pulls down the corner of your mouth. And if you put a couple units of Botox into this area, it kind of turns your frown upside down a little bit, so you don't look quite so angry. And that's a very subtle but real improvement that you can get with a couple units of Botox. Bunny lines, some people, for whatever reason, have very prominent bunny lines, and they can be relaxed so that the skin doesn't get so bunchy. And then an area I love to treat, the neck. Some people just have very prominent neck bands, both when they kind of clench their neck and at rest, and you can put Botox directly into this, and you can see how much better she looks there. And then same.
What is that thing?
It's a muscle called the platysma. It's a platysmal band, and they become more noticeable with time, and they can really disrupt the contour of the neck. So with Botox, it's a muscle that then relaxes, and so it's no longer so strongly contracted and noticeable.
Doctor,
Yes.
so with something like that, would you find that there might be some reaction to either how you swallow or something?
I think you'd have to use very high doses for that to occur. There have been reports of that occurring, but it's typically in people who have much higher doses than what we would use here. I think there's someone that once mentioned that she was having her hair shampooed, like at the salon, and it was hard for her to lift her neck up. But you'd really have to use a much higher dose than we would typically recommend. So I find most people don't have any problems with that. This is an interesting one as well. So this patient, she has very strong masseter muscles, and so that gives her lower face kind of like a boxy appearance. And you can inject Botox directly into this muscle, so it kind of relax it. And so you can see now in the afterwards, her face has a more of an oval shape, which is a more cosmetically appealing look, and that's true for this patient as well. So very strong jaw, and it can be relaxed, and you can see how she looks better there. For Botox treatments, it's somewhat similar to a filler treatment, although like Mike mentioned, you don't typically need numbing medicine. It's offered, but I find the needles are so small, the procedure's so quick that it's very comfortable, and most people don't need numbing. There can also be some mild redness and swelling and even bruising with Botox, but it's less likely compared to filler. And then the results don't show up right away. Like Mike mentioned, it could be 5 or 6 days, before you see the final results. Sometimes it can even be 14 days before you see the absolute final results. So you do have to give it some time. And it can last 3 months, 4 months. Some people seem to think it lasts even longer occasionally, so it varies person to person. So if you haven't had any of these treatments with us and you're interested, the first step is to schedule a cosmetic consult. And then at that time, we'll go over your concerns, what you notice, and then we'll help you to come up with a treatment plan and give you a price for the things you're interested in. And that's it. Thank you so much for your time. And if you have questions, I'm happy to answer them.